head assessment of an infant 1 month old. So first, we must examine the head. So in examining the head, we must inspect the head symmetry, for the symmetry of the head, for the lesions, and check for the sutures, the sagittal suture, the coronal suture, the myctopic suture, and the lambdoid suture. So after checking for the sutures, let's check for the fontanelles. So for the fontanelles, the anterior fontanelle is in diamond in shape. It is usually 4 to 6 cm, and it is closest by 6 to 24 months. While the posterior fontanelle is triangular in shape, it measures 1 to 2 cm, and it usually closes at 2 months. Then after that, let us check for the caput succedaneum. So it is the protrusion of the head due to expulsion from the vagina. So let us check for it, and let us measure the head also. So in 1 month old infant, it should be 13 inches, 13.5 inches. So in my case, it is 13.5 inches. So next, check for the McEwen sign. So for the McEwen sign, it is for checking for if the patient has hydrocephalus. So it is by tapping into the parietal area, both sides. Okay. Should observe for crackpot sound. So okay. So after that, check the overall impression of the head. If the baby is crying, or the baby has symmetrical eyes, midline nose, all of the first impression. Then after that, after checking for the head, let us check for the Weber's and Rein's test. So, kuya, for example, is an infant, okay? Or for a child. Okay. Kaya sabihin mo sa akin pag naririnig mo, ha?
Sige po.
Okay, o kaya may pagkakaiba sa kanan or kaliwa. Okay? So, didinig mo ba?
Apo.
Saan mas malakas? Walang mas malakas? Parehas lang?
Parehas lang.
Parehas lang. Okay. So, that's for Weber and Rein's test. Rein's test, okay. Dinig mo ba?
Apo.
Ito.
Apo.
Okay, kabila. Dinig mo?
Apo.
Ito. Then after stating all the findings, so he has no lateralization, and his hearing is adequate in bone conduction and air conduction. So next is for the BP. Let us check for the BP. Let us know the adequate size for the cuff. So in 1 month old infant, it is usually 6 by 12. But for older child or older children, it would be 9 by 18. So for example, assuming that it is the right cuff, do not put it too loose or too tight, because it might affect the BP. Put the patient's arm in the align with the chest, or on the table preferably. Then warm it. Get ready. Okay. So supine the arm. Inflate plus 30 to the expected systolic BP. Then release 2 to 3 per heartbeat. Okay. So for my patient, it is 90/60.